My name is Renan Augusto. I'm a client liaison manager and marketing coordinator with SmithLife Homecare. I'd like to start off by thanking Oasis for this wonderful presentation they have arranged. Now it's my wonderful pleasure to introduce Ms. Kathleen McGuinness, an industry expert in the home care industry. Kathleen is a third-generation Washingtonian. She started her career as an executive with a Fortune 500 company in Washington, D.C. Kathleen later served as a senior leader with a foreign government in the British West Indies. Kathleen has conducted presentations globally on a variety of topics through radio, television, and in person to audiences of 500 viewers with excellent reviews. Kathleen later cared for her parents while they aged in place. Kathleen became a home care consultant in 2015. Currently, Kathleen is a director of community relations for SmithLife Homecare, which is a joint venture of the Charles E. Smith Life Communities and Augustine Home Healthcare. Kathleen's extensive background in the home care industry is viewed as an expert by many because of her credentials as a certified dementia practitioner, her certificate end-of-life specialist, and being a certified home senior safety specialist. Kathleen's most recent focus has included bringing high-quality, value-based care to the community known as Friendship Heights Village. She recently pioneered opening an office in Friendship Heights specifically designed to serve the residents there. But please keep in mind that SmithLife Homecare serves all of Montgomery County and Washington, D.C. Now it's my great pleasure to introduce and turn it over to Ms. Kathleen McGuinness.
Thank you, Renan. Nice job. Good morning, everyone. We're all excited to be here. This is the first time for this presentation in partnership with Washington Metro Oasis. It is meant to be an educational, informational seminar. I will have questions. I'll take questions at halftime. And this is basically about home care, no matter which agency you hire. There are some basic 101 facts you should be aware of before you engage home care for your loved one. So a guide for the families, and some of the topics that we'll discuss today is what is home care versus home health care. This is interchangeable topics that often get confused, and they mean very different things. Second part of this would be how to know if your loved one needs help in home. Third, why to consider in-home care. Fourth, we have some ways for free money, believe it or not. There is still such a thing out there in ways to pay for home care. Well, I guess nothing is free. Our tax dollars pay for it somehow. And interview questions to ask when you interview a home care company. I strongly recommend you interview at least 2 and maybe 3 home care companies to see what the right parameters are, the right fit for you, personality-wise, and what they offer. So I would suggest that you grab a pen and paper. Feel free to write down some of your questions as we go along. Around slide 8, I'll take a break and we can ask questions, and then we'll take questions again at the end of this presentation. Does anybody have any questions before we start? Okay, so as Renan said, I'm very involved in our community in Montgomery County and Washington, D.C. These are some of the functions I perform free as a volunteer to continue to grow my knowledge and to pass on my experience as a family caregiver personally. I have been a family caregiver for longer than I would care to remember, and I'll talk more about that as we go along. So as Renan mentioned, this is part of my bio. That just gives me some credentials in this marketplace. And I'm very happy to be a third-generation Washingtonian. I've been around this town for a long time. So I do have a fair amount of local experience, and particularly in the marketplace, partnerships that add value to my community that is served with SmithLife Homecare. So in the first place, the first misnomer, I would call it, in the marketplace is home care versus home health care. On the left-hand side, you'll see home care is assistance with ADLs, which is your activities of daily living, provided by trained professionals like CNAs, which is a certified nursing assistant, or an HHA, which is a home health aide, or a CMT, which is a certified medical technician. And those types of caregivers, professionally trained caregivers that you would engage from an agency like SmithLife Homecare, Capital City Nursing, Life Matters, that is considered home care. Home health is medically prescribed care at home with care performed by clinical staff, such as a registered nurse, an occupational therapist, a physical therapist, a speech therapist. Many people need wound care at home, and that's called episodic care, and it is prescribed by a physician. Medicare will pay for all of these home health medically prescribed procedures. Medicare does not pay, generally speaking, for home care. So now we'll go through some facts and fiction, truth versus fiction. So a fact, oops, wait a minute. I'm missing my first one. Oh, sorry. Bad technology here. Go back to this one. Okay, so fact. You can change home care with 24, 48 hours notice. Yes, you know, actually we're missing a slide up. I'm sorry. The first part of that question, which was fiction, is that once you sign up for home care, it's your plan for life. And that is not true. I don't know how that disappeared off the screen, but it did. So the fact is that you can change any plan that you sign up with a home care company within 24 or 48 hours notice. It may look like a daunting agreement. Ours is 10 pages, but most of it is HIPAA documentation. So you should know that if you change your mind after signing up for home care with a particular entity, you could cancel it. You just have to send them a notice in writing. If you can imagine, many of our clients that we sign up in a hospital for care when they go home, unfortunately, they pass away. So therefore, most of these contracts are non-binding. Another piece of fiction out there is many nonprofit home care companies are less expensive. That is not true, at least in this metropolitan area. Many nonprofit home care companies charge the same. Some of them actually charge more than for-profit companies. Another piece of fiction in the marketplace now, post-COVID, is that it's easy to just get 2 days of care per week for 4 hours of day. The fact is that post-COVID, there is an extreme, not quite as bad as it was 6 months ago, but there is an industry shortage of staff, whether you're in a hospital or whether you're working with a home care agency, and everyone has changed their minimums. All home care companies. That's why I suggest you interview at least 2 or 3 to find out what their minimums are. Our particular minimum now is 3 days per week, 5 hours a day, except if you happen to live on the Charles E. Smith Life Communities campus, decline, or in Friendship Heights area, you can have less care, but that's the exception. Many home care companies will require that you have 8 hours of care, not 5. So that's a good question for you to ask when you're interviewing. Oh, that's where that went. How to know if your loved one needs help at home. These are some questions to ask yourself if you're uncomfortable asking your loved one, or just to observe. Has there been a fall or recent hospitalization in the last 6 months? That's one indicator that it may be time to start having somebody in the home for additional support. Is assistance needed with bathing or dressing? Are there falls? Are they uncomfortable or nervous about getting in the shower themselves? Does the person take more than 4 medications? I remember for my husband, I had a pill box, and sometimes I'd leave the house and it'd be Monday and I'd come back and all the medications were gone up to Wednesday. I'm like, oh my God, what happened? Sometimes they just don't keep track of the days. Is the person incontinent? Have you noticed changes in grooming? Again, speaking from my own experience, my husband was a meticulous dresser, very crisp starch shirts, a very well-groomed person. And I noticed that there was food on his shirt. He wasn't changing his clothes. He would wear the same shirt 2 days in a row, which was really totally out of character. So these are just a lot of small clues that I think if you have more than 2 or 3, it may be time for you to consider having some additional support at home. So here we're going to start with the fact versus fiction. Fiction is caregiving at home is easy for the spouse or the adult child. This is really fiction. The fact is, rough statistics show that 38% of family caregivers, spouse, adult child, whomever is helping to care for a family member, die before the person they're caring for. If you're a family caregiver out there, I suggest you reread this. 38% of family caregivers die before those they're caring for. And I strongly recommend that you get in a support group or consider having help in your home 2 or 3 days a week. Again, from personal experience, I cared for my mom, my dad, my husband, and actually my mother-in-law 35 years ago in my mid-30s when I was raising 2 young children, and my mother-in-law who moved in our house, which I do not recommend. She was very cranky. It's very challenging. I noticed when my husband passed away, I had not been to my own personal doctor in over 2 years. So I think that increases the odds that people don't take care of themselves because there's not enough time to take care of yourself and your loved one. So that's why I think it's great to get help 2 or 3 mornings a week so that you can get out and take care of your own personal appointments. Fiction. It's better to hire someone I know personally or a neighbor to provide care at home. Fact. It's a complex issue. As long as you are willing to pay federal, state, and Social Security taxes, perform your own background check, ensure your personal liability insurance is up to par, and know that you can do without a backup caregiver in case of an illness for the caregiver's child is sick, the caregiver has the flu, has COVID, can't come. If it's okay that you don't have a backup, then sometimes it is. It may be better for you financially to hire someone you know. You just need to be aware of all of the issues that are involved. Agencies are excellent care partners. They do all of this for you, and they provide backup care. So it takes a significant load off your plate. Again, part 2, how do you know if your loved one needs help at home? Does he or she need assistance removing meds from bottles or pill boxes? You may or may not know that there are many pillboxes out there now that you can lock, which I found out were very helpful because it gets to a certain point with some of the people that you're caring for that they're not trustworthy with medication. If the person uses assistive devices such as a walker, a cane, or a wheelchair, my husband used walking sticks. He did not want to be seen with a walker. That wouldn't fit his personal image. But all of these assistive devices can add to the tripping factor, as I call it. If you turn around too quickly, whatever, without support or without somebody at your elbow, it can cause a fall. And this one I found to be the most telling. What assistance would be needed in case of emergency? Can he or she be left alone? So while it's rare, but if the fire alarm goes off, I knew it would be unsafe for me to leave my husband home alone, or my father, or my mother. Initially, in the beginning, it was okay, but as their variety of illnesses progressed, it was no longer safe to leave them home alone. If there was a fire alarm, they would have no clue what to do. They would just sit here. Okay, so I'm going to take questions after this slide. So here are some suggestions about why to consider in-home care. First of all, it saves thousands, statistically speaking, billions, for people getting care at home as opposed to in a hospital. Many people in this Washington metropolitan area are home alone. They don't have a spouse, they don't have children, they don't have a family member nearby. And many of those people end up staying in hospitals much longer than they should because they're not a safe discharge. Another reason people are getting care at home is because most people want to age in place in their own home. More than 65% of the seniors will need assistance with their ADLs. More than 10,000 people, I found that to be a staggering number. More than 10,000 people in the United States turn 65 every day, and that is expected to continue until 2030. So there are over 400 registered home care companies in this metropolitan area, and a lot more unlicensed home care companies in this area. And that's part of the reason why there is a huge demographic over 65 in this metropolitan area. So people choose to have care at home for socialization. I can think here in Friendship Heights, where I live, I can name, 15 clients in this 11 high rises here, where people live alone and they have a caregiver come in 2 days a week just because they're lonely. They're looking for companionship, somebody to talk to, and somebody that can help them with just some basic chores around the house. Our caregivers are not maids, they're certified nursing assistants, and they're offended if you think that they're a maid, but will they help you change your sheets and make your life a little easier? Yes, absolutely. Also, something to be said about your dignity remaining at home. Many ILs, which is independent living, or ALs, which is assisted living, offer nice experiences for many people, but for others, there is no place like home. And then you have the curmudgeons out there like my dad. He is not going anywhere, period, full stop. He did end up going somewhere, but that was because he was hospitalized with a urinary tract infection, fell, had back issues, and became bedridden, and therefore was in a nursing home. So as you probably know, fall prevention, falls are the leading cause of fatal and non-fatal injuries in the home. A personal caregiver can help ensure a safe path in the home. They help keep the client steady while on their feet to and from the toilet, to or from the shower, or in the shower. Many of our short-term cases are just for that, to make sure the person takes a safe shower at least 3 times a week, and to help them with some household chores. So we'll go into the fact or fiction. These are meant to be generic facts that I learned through personal experience and also professional experience. Families never need to pay any more for home care or personal aids once you move into an independent living facility, an assisted living facility, or a nursing home. That is false. The fact is, 1/4 of our care clients, they're called home care, but because home is wherever you designate it. Some homes in assisted living or nursing homes, we have caregivers that come in every day in nursing homes because the nursing home is too short-staffed, or in independent living because they're transitioning from independent living. They really should be in assisted living or in a nursing home, but they don't want to go. So we literally have people in independent living facilities who are receiving 24/7 care from our caregivers. That gets really expensive, but some people can afford it, and that's their choice. We're happy to accommodate. Most adult children of seniors prefer their parents' loved ones to age in place at home. I was surprised to read that several national surveys concluded that 83% of baby boomers and Gen Xers prefer their parents reside in a professional senior care facility. So I think the reason for that is I'm a baby boomer, and I wanted my mother to be in an assisted living facility because I felt she would be safer there. I felt that there would be more people around, there would be a community, and there was a community, and there were more people around, but she fell down just as easily in an assisted living as she did at home. So just food for thought. At the end of the day, I think it's very important that you evaluate your particular family's personal needs of in-home care versus assisted living or nursing home. I strongly recommend that you hire a geriatric care manager or a social worker. There are literally hundreds of them in this area to help you sort this out for your particular family's needs. So I only have about 10 more slides that are quick. Does anybody have any questions for the moment? Yes, Max?
Yes, my question is, you said for, excuse me, under the category of home health care assistance, that it can be paid by Medicare?
Yes.
So the question is that limited to a certain period of time?
Yes.
And what is that period of time?
It depends. It depends on the person's injury. It depends on where they are, if they're in a home environment or if they're in a medical setting. And it just
Well, what
depends.
if they're at home?
If they're at home, again, it depends on their injury and how long the doctor prescribes, say, physical therapy. Some doctors may say you just need physical therapy twice a week for 30 days. Other doctors may say you need physical therapy 3 times a week for 90 days. A lot of it depends on what your physician orders and what you lobby your physician for. So if you don't think it's enough, go back and tell them it's not enough. Anyone else? I can't see all the screens out there. I could only see the first couple. Anybody else have a hand raised, Renan?
No,
Kathleen, oh,
Yes.
sorry. Kathleen, you mentioned two options when you're deciding to find care for your loved one. So you mentioned geriatric care manager, and what was the other one?
Social worker.
Social work. Thank you.
I do see a hand raised. I believe it's Jared.
Looks like Jan.
Yes, hi. Can you provide a list of good social workers or geriatric care workers that you could recommend that we could use?
I don't have a succinct list. I am going to a geriatric care managers conference in Philadelphia on Monday. If you eat, Deborah Levy, Elder Care, Seabury, and Iona are three of the top ones in this area, but I can, if you email me afterwards, I can give you some names and numbers.
Perfect, thank you.
You're welcome. Okay, we're going to move on and I'll take more questions at the end. So funding sources for in-home care, obviously out of pocket, family funded. That's number one. Private insurance, long-term care insurance, whole life insurance. Your whole life insurance builds cash value. You can borrow from that policy to help pay for home care. Reverse mortgages. There are plenty of brokers in this area that will help you with a reverse mortgage. Mutual of Omaha Care Funding Solutions. At this website, fundsforcare.com, they have a lot of creative long-term or life insurance policies that will help you pull money out. In the fact versus fiction category, some families think they have too much money in savings or make too much annually to receive any kind of financial support for home care in Montgomery County. However, there is good news. And a fact is, if you are 60 plus and caring for a frail senior in your home who is also 60 plus, you can qualify for up to 40 hours of home care per month for approximately 3 months from an approved ARC consortium agency. SmithLife Homecare is such an approved provider. So that's approximately $1,240 per month for a limited time, and this applies to Montgomery County only. It's a fabulous benefit of living in a wealthy county. ARC has an application. It's about 10 pages. You must reside in the same house. Your driver's license must match, but it's a big help. That's, $3,000 plus. That is free money that you just have to apply for. And any home care company that you choose should be asking you these questions to know if you qualify for this grant. It's respite care. It's designed to give the care provider a break because the health consequences for not getting a break are not good. So it helps defray somebody ending up in the hospital. Fiction. You cannot deduct any home care expenses off your taxes. Fact is, yes, you can. Obviously, consult your tax professional. You can deduct certain expenses. To qualify for a tax break, they generally need to be more than 7.5% of your adjusted gross income, but there are exceptions. You should ask your home care company that's providing care for you for a statement, an itemized statement at the end of the year that will give you a total tally of all that you've paid that year. Any home care company should provide that to you. On this left side of the screen, here's a few more funding sources for in-home care. If the family member is a veteran, there's aid and attendance program. I received that from my dad, who was a partially disabled veteran. Obviously, there's Medicare. There's Medicaid. And then this is the ARC Senior Respite Program that I spoke about a few minutes ago. 60, caring for somebody 60. You don't have to be a family member. You can just be two women living together, taking care of each other as you age in place. That's the website, respite@arcmontmd.org. And that's the phone number there to call for more information about how you can qualify for ARC respite care in Montgomery County only. Fact versus fiction. Medicare will pay for your mom or dad's nursing home care. Fiction, fiction, fiction. Sadly, Medicare, well, it's a complicated story, but basically Part A of Medicare, to Max's question, will pay the bill for up to 20 days of skilled nursing care facility. Hypothetically, you have a slip and fall, you break your hip, you're sent to a rehab, you get 20 days of skilled nursing care paid for by Medicare. After that, you begin to pay some part of the nursing facility's care. After 100 days, Medicare will not pay a penny of nursing rehab home care cost. It all has to be paid out of pocket, unless somehow the patient can go without skilled care for 60 days, 30 days, and then they end up back in the hospital. In that case, Medicare clock resets. So while it sounds like 100 days of care is a long time, I have many clients with traumatic brain injuries. They were a perfectly healthy human being at 60 years old, bicycling along. They have a traumatic brain injury from a car bicycle accident. They're in the hospital for a very long time, 6 months to a year. That comes, unfortunately, out of pocket, or you need to get on Medicaid. Briefly, Medicaid versus Medicare are two different programs. Medicare covers citizens age 65 and over, as well as those with certain chronic conditions. Medicaid is typically available to those of lower income and helps provide health care at little or no cost. Each is regulated by its own set of laws and policies, and the programs are usually designed for two sets of people. However, recently you have been able to combine Medicare and Medicaid for the same human being. It's complicated. I recommend you get an elder care lawyer certified by the National Association of Elder Law Attorneys to sort of dig into that issue. It is very complicated. Fiction. Medicaid will not pay any nursing home cost. Medicaid will pay nursing home cost, but to drill it down to a very simple fact is that you cannot have more than $3,000 in countable assets if you're a couple to get on Medicaid. Again, I strongly recommend, many people do get on Medicaid. They divest themselves of assets. Some people get divorced so that the spouse can live, and they divest all the assets into one spouse. Again, it's a complicated process. It can be done. It is legal. And you would want to consult an elder care attorney if you are looking at long-term nursing home care, which is about somewhere between $8,000 to $15,000 a month in this metropolitan area. Coming to the end here, what should you expect when you hire a home care provider via an agency? Some of the key things that you should expect is a written agreement for care to be signed, and one that can be canceled within 24 to 48 hours. By law, if you sign an agreement with a home care agency, an RN assessment is to be done prior to the start of care. That registered nurse writes a written care plan that the caregiver, who's coming in 3 mornings a week, is supposed to follow and checks off on an electronic task list in her phone. Some agencies charge $125 for this visit. We consider it the cost of doing business at SmithLife Homecare. We don't charge for this visit. You should expect a caregiver who's passed multiple background checks, especially driving if they're driving your loved one. You don't want to see a DUI on your caregiver's driving record. If we do, we don't hire them. A written care plan, as I mentioned earlier, and you should also have an account manager and a scheduling coordinator specifically assigned to your family for changes that occur. What else? Part 2, what else should you expect when you hire a home care provider via an agency? That's the same slide. A systematic billing process and a total accounting provided at the end of every month and at the end of the year for your taxes. You should expect all staff payroll taxes. The agency should have at least $2 million of liability insurance, should have current state licensure, should have at least 1 RN on staff and a director of nursing, and have a 24/7 phone line for emergencies. No one trips and falls generally at a convenient time. It happens at 11 o'clock at night, 2 o'clock in the morning. If that's your experience, you should be dialing 911 and then calling our office. In our case, our caregivers go with the client to the hospital. They're not allowed to leave the client they're caring for until the family tells us to do that. You should expect a caregiver who has been trained as a certified nursing assistant with some additional specialized training in dementia, post-operation care, other specialties. Our caregivers are also trained in kosher. We don't want anybody trafing up anybody's house. I did that with one of my first clients and it was not a good thing. 17. Items to be aware of. You can hire an independent caregiver, meaning non-agency. There are registries out there. There is care.com where you can just go straight to the caregiver and hire them. But you need to be aware that you are the employer. You need to perform a background check when you're hiring them. You can do that online. Caregivers generally do not have liability insurance. If they have a slip and fall in the house, you are liable for them. You don't have a backup should the caregiver get sick. This may or may not be important to you. I had a caregiver come read to my father. My father loved Western novels, and I traveled quite a bit when he was at that stage of his life. So I hired a caregiver to come read to him 4 days a week. So if the caregiver didn't show up or got sick, it wasn't a tragedy because he was not home alone. He was in a skilled facility. But, just think about your circumstances and what makes sense for you. You do need to locate them, hire them, and train them in many circumstances. The family becomes the employer. You need to manage the payroll and withholdings. But the caregivers can be less expensive. You don't have the overhead. You don't have the electronic system that we have where caregivers clock in and clock out. You don't have the payroll, the withholdings, and all of the overhead that an agency does. And one thing that's interesting is that if you hire a private duty caregiver, an independent caregiver, they can perform a broader range of support services. Our caregivers are bound by licensing laws in the state of Maryland or the District of Columbia. Our caregivers can't do a feeding tube. They are legally not allowed to. If you hire a private caregiver and you want to teach them how to do a feeding tube, you can do that. Our caregivers cannot empty a colostomy bag legally. They can empty a catheter bag, but we are bound by Maryland laws and would lose our license if our caregiver was found dispensing medication to your mom, dad, husband, whomever. In order to dispense medication, you need to hire a certified medical technician. A caregiver can put the pill box in the client's hand, or they can crush it up in applesauce, and then the client can take that cup and take it themselves. But technically, we are not supposed to put it from our hand to the client's hand. There's just laws about that. Things for you to consider if you are a family caregiver is to avoid caregiver burnout, especially with Alzheimer's and other progressive diseases in your loved one. It's a very difficult, challenging job. And you will notice if you find yourself edgy, you're not doing things you used to do, you can really become very consumed caring for a loved one in your family. And that is a beautiful thing regarding Montgomery County respite care through ARC. That gives you, 8 hours a week where you can have a day out just for yourself. Take care of yourself. Here's something, this is one little tiny commercial in here. I've tried to be unbiased and give you all the information about the community. If you do have a loved one who needs help getting to and from a colonoscopy appointment, colonoscopy appointment, we have a package of $145 that will pick up your loved one at home, take them to wherever their colonoscopy is being performed, wait for them, take them back home, put them in their jammies, give them a cup of soup, and boom, that's it. Short-term care. We also have other transition to home packages, $425 for 18 hours of home care service. I devised both of these packages because my husband needed this care and such a thing didn't exist. So for somebody getting a knee replacement, 6 hours of care for the first 3 days, it's usually plenty. Then they get home health care, rehab, et cetera, going forward. But it's a nice price point so you can provide manageable care. Obviously, SmithLife Homecare provides 24/7 care or any variation of that to Montgomery County and Washington, D.C.